Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, elective gastric ulcer operations. So, elective gastric ulcer operations which are done for the types of gastric ulcers. So, according to the in the gastric ulcer treatment, elective procedures. Elective procedures can be divided based on the types of the gastric ulcer. For type 1 gastric ulcer, we can do a distal gastrectomy is done with Billroth 2 reconstruction. For type 1 gastrectomy, we can do a Billroth 1 or Billroth 2 reconstruction can be done by doing a distal gastrectomy. Just a minute. Right. So for type 1 gastrectomy, actually the type 1 gastric ulcer is a gastric ulcer which is present at the incisura terminalis in the lesser curvature. So it is something present here. So because it is present in the lesser curvature in the incisura terminalis, you will resect this, you will do a distal gastrectomy, and then you can do either a Billroth 1 anastomosis can be done like this, or you can do a Billroth 2 anastomosis can be done. So this is for type 1 gastrectomy. In type 2 gastrectomy is actually here you will have two ulcers are present. One in the body of the stomach, second in the pylorus or in the duodenum, or first part of duodenum. Actually it is present in the first part of duodenum. Whereas in type 3 gastric ulcer, there is an ulcer which is present in the antrum of the stomach. So in both these cases, because the duodenum is involved, duodenum and the pylorus and that part is involved, so it is better to do a total vagotomy is done with an antrectomy is done. Then in type 4 gastric ulcer, the ulcer is present at the gastroesophagogastric junction in the lesser curvature somewhere here. So for that we have some named procedures like Shoemaker's procedure, Pouchet's procedure, Kellinger's Midliner procedure and Sens procedure can be done for the type 4 gastric ulcers. So these are the elective procedures which are present for these gastric ulcers.
thank you and thank you for watching.